Hearts run right to the end. People come on, you don't need to be scared. Cause you're gonna love again.
Hi, and welcome to the premiere episode of the Haider Rifaat Show Season 9 specials. Season 9 is part of the Haider Rifaat Show's new format, which features periodic interviews with special guests, and today is no exception. Today, I've been joined by Dr. Stephanie Si Lim, who is a cancer researcher at the University of Hawaii Cancer Center. The University of Hawaii Cancer Center is the only NCI-designated cancer center in Hawaii and the Pacific. And the mission of the Cancer Center overall is to reduce cancer burden in Hawaii and the Pacific, which is a big deal considering that it is based in that kind of location where the need to address cancer is really important. So thank you so much, Dr. Si Lim, for joining me. It's a pleasure having you on the show.
Thank you, Heather, for having me. It's so exciting to be in your fantastic show, and I'm just really excited to be part of it.
Thank you so much. I appreciate it. So first of all, I know that I'm going to tell the viewers first what we're going to be addressing in this interview. We are going to be talking about CAR T cell therapy, which is known as chimeric antigen receptor T cell therapy. Dr. Stephanie C. Lim actually brought this form of therapy in Hawaii in 2022, and she's the first person to do so. So that makes her kind of like a trailblazer in this regard. Um, and what is CAR T cell therapy? We'll be asking her, and we'll be also talking about clinical trials, cancer clinical trials in Hawaii, and what they mean as well. So this is kind of like an informative and a learning curve for all of us. So first and foremost, Dr. Seelan, before I move into the specifics of my questions, I want to first ask you, what got you interested in studying cancer, and why specifically Hawaii?
That's a good question. Okay. So I guess let me just introduce myself a little bit too to your audience. So I was actually born and raised, no, I was raised in Hong Kong for 19 years, and that's where my parents still live today. And I came to the States for college. I did my residency and fellowship training program at the Children's Hospital of Philadelphia, and I worked along, really fantastic physicians and researchers who just did amazing work both clinically and also from a scientific kind of basic science research standpoint. And so the question of why I came back to Hawaii is actually a little bit of a romantic story. So while I was in residency and in fellowship in Philadelphia, I met my husband there. So he was a local boy. He is a local boy who was born and raised in Hawaii. And on our first date, he asked me over coffee, "Hey, I'm from Hawaii. I would like to go back one day." And I was like, "Okay, sure." But 8 years later, here I am. So after we got married, we ended up deciding to come back home to Hawaii to build both of our careers and practices. So that's how I came back to Hawaii. Now, in terms of why I became a kind of pediatric oncologist, or why I like cancer. So since young, I've always liked children. I just find them to be really fun to be around. I liked teaching them. And so I started my career actually wanting to be a kindergarten teacher. And then when I went to college, I took a couple of classes, I think anatomy and physiology, and I just was so fascinated by the human body and the biology of it. And so decided to kind of look into the medical field. And I did a couple of volunteer work at the Children's Hospital. And one of the first wards that they actually put me into was the pediatric oncology ward. And so there I kind of learned about what that was all about. And I really loved it. I love that being an oncologist means that not only do you take care of patients clinically, but you also get to build a relationship with the families really for years to come, right? It's one of the most difficult times for the families, most vulnerable times for them. You get to be there for them, walk them through the diagnosis, the treatment, and of course, end of therapy and onwards. So it's just a very special relationship. So that's how I like research and cancer.
Yeah, and I think that's a great story, not just for your career, but also personally. So thank you for sharing that. Um,
Yeah.
I wanted to also ask you about, like I was mentioning in my introduction, and also my lead was that CAR T cell therapy. So you were the first person to bring it in Hawaii, and CAR T cell therapy, for the viewers who don't know, stands for chimeric antigen receptor T cell therapy. First of all, what is CAR T cell therapy, and how is it reducing cancer burden in Hawaii specifically?
So CAR, as you mentioned, stands for chimeric antigen receptor T cells. And so what that means is that scientists can actually use what we call a viral vector to insert a gene that codes for a very specific receptor into the patient's own immune cells, and in this case, the T cells. And then that T cell can actually recognize a very specific marker on the cancer cells. And so there's a couple of differences between CAR T cells and the traditional kind of chemotherapy that you think about, right? So um, traditional chemotherapy, you think about the non-specific side effects like hair loss, nausea, mucositis, just all these kind of non-specific side effects. But with CAR T cells, because it really targets a specific marker on the cancer cells, you don't really get those non-specific side effects. You do get side effects, but they're more just kind of like the body's inflammatory reaction to help fight the cancer cells. Instead of giving it over months, CAR T cells is actually given over just a couple of minutes in an outpatient clinic. So patients can actually go home that same day, which is pretty remarkable. Um, and how, and the history of CAR T cells has been around for over 30 years, but it just got recently FDA approved in 2017. And it has been just life-changing for patients with very difficult to treat cancers, because currently the indication for it is patients who have had 2 or 3 more lines of chemotherapy and cancer therapy that has failed, and then you use CAR T. And what happens is that we're actually seeing that the CAR T therapy is actually curing these patients. And so bring it here to Hawaii is very special, right? We are a very beautiful place, but we're also about 4,000 miles away from the nearest city on the mainland. And so access to novel therapies and innovative therapies, and you'll talk about this later about clinical trials, is extremely important for our patients, because can you imagine patients who are from a neighbor island, from Pacific Islands, who has to travel 4,000 miles away when they're very sick with their cancer, to be away from their family and friends, let alone the financial cost too of doing all of this, and then get a treatment that could not work. I mean, it's so much for the patients. And so to be able to open clinical trials and provide therapies like CAR T therapy to our island is so important, so that everybody here within our medical community can get access to these therapies.
Mhm. Yes, definitely. That's really important. And for the viewers who don't know, like cancer in Hawaii, like it has like different kinds of trends, but like traveling, like you were mentioning, traveling out of state is really, really difficult for these sick patients, especially going through extreme forms of cancer. So I think it's remarkable that you were able to bring this therapy to Hawaii, and I'm sure it's helping a lot. But I want to ask you also specifically, what kind of cancers does CAR T cell therapy suppress? And do you think that are children also part of this therapy, or is it just aimed at adults?
Yeah, so right now the FDA approved indication, which means that it's kind of the United States form of approving commercial products, is only for blood cancers, and so lymphomas, leukemias, multiple myelomas, etc. Right now we have 6 approved commercial products, one of which is for children and young adults less than 25 years old. The rest of the products are all for adult indication as well. So um, that's what we have for it. But I mean, in the next 10 years, or even 5 years, there's going to be an explosion of just CAR T therapies, I believe, for more cancers: breast cancer, lung cancer, prostate cancer, you name it, because there are currently about 1,000 and more clinical trials that's just around the world, hoping to be targeted for more therapies in the future, more cancers in the future.
I believe you were mentioning in your earlier answer that was regarding CAR T cell therapy, and how it's kind of like used as a last resort if certain cancers which are difficult to treat, they are not able to be treated, so CAR T cell therapy can come in and fill that gap.
Yeah.
Is it correct? And do you think that it has helped since you've brought the therapy in Hawaii? And if yes, then what kind of extreme cancers has this therapy been successful at in treating?
Oh yeah, definitely. So we opened our program in 2022, but really we didn't treat our first patient until about 6, 7 months ago now. And since then we've had a total of three and a few more kind of that we're hoping to treat in the next few months. And so I'll give you a really good patient example because I think it really highlights kind of how powerful this therapy is and how great this therapy is. So our first patient that we treated was just a wonderful lady whom unfortunately was in her third relapse of cancer. And so she was treated since I think 2021, and she's gone through multiple kind of rounds of chemotherapy, radiation, et cetera, et cetera. And at one point, she was actually referred to the mainland or for the mainland United States to get CAR T therapy. But unfortunately, her husband, whom she's the primary caretaker of, also had end-stage esophageal cancer. And so being the primary caretaker, there's no way she can leave his side, right? To go to the mainland United States to get this therapy for a couple of months and then come back. And so we ended up bridging her with other therapies. But thankfully, when her tumor came back for the third or fourth time, we had just opened our first CAR T trial. And so she became the first person who received this therapy. And she is now 6 or 7 months now out from therapy, and she still remains in remission and cancer free. So I think this is a good story to highlight how great this therapy could be.
Yeah, definitely. I feel like it's remarkable when these kind of breakthroughs in science and cancer come about and they can really impact lives. So I think you're doing some fantastic work. So thank you, first of all, for that. Um, I wanted to also speak a little bit about cancer clinical trials because people are also not familiar with that, especially the viewers of my show. What are cancer clinical trials and is CAR T cell therapy also considered a clinical trial, or would you consider it more than just that?
Yeah, definitely. So clinical trials, I think that's actually a really good question, and it's good for your viewers as well. Clinical trials sounds scary. A lot of my patients actually are very skeptical of it because they're always thinking about whether or not, oh, is this like some experiment that you're doing on me or my child? Is it well vetted for? I mean, I can tell you that, in the United States, clinical trials are very, very rigorous. I mean, as an example, I told you that CAR T therapy has actually been studied, right, for over 30 years, but it wasn't FDA approved until 2017. So it really took about 20, 25 years of rigorous scientific experimentation on different types of cell lines, of mouse models, and lots of trials too in humans to make sure it is safe for patients. Now, clinical trials in the oncology world, in the cancer world, is always going to be vetted for usually the standard of care. So it's never going to be like, oh, we give you nothing, which is a lot of people ask me. So you're just going to give me a sugar pill and then you're going to give me a cancer therapy. It's never going to be like this because that's just not ethically right. And so it's always going to be compared to whatever the standard of care treatment is for that particular disease. Compare it to the new um, therapy that you're trying to test or you're trying to bring onto the market. So that's what a clinical trial is. And to your second question of CAR T therapy, so yes, it is a commercially approved product, but there's still a huge universe out there with CAR T cells, clinical trials that is ongoing all over the world.
Mhm. Right. Um, Also, there are some ethnic differences in cancer that we also see. So moving a little beyond
Yeah.
cancer clinical trials. Um, So, for example, there are ethnic differences in cancer. Just to give you a few instances, lung cancer incidence is highest in Filipinos and Native Hawaiians. Thyroid cancer incidence is highest in Filipino women, and liver cancer incidence and mortality are highest in Native Hawaiian men. So these are just a few examples to cite, but why are some groups more vulnerable than others when it comes to cancer?
You asked me why I became a oncologist or a pediatric oncologist, and this is exactly why. Because there is so much we still don't know and understand about the biology of cancer, and this is exactly one of them. Why is it exactly that, as you mentioned, certain ethnic groups and races
Yeah.
have a higher incidence of cancers? And the best reason that I can tell you right now is because of genetic differences. We do know that for certain cancers, they're just more prone to harbor certain mutations, therefore at a higher likelihood of developing whatever it is cancer that they have. Now, is there more to this? I mean, honestly, probably. And so the next question to us is, okay, so we know that certain populations have a higher incidence of it. Now, do they respond to therapies differently is also the second question, right? And I think that's where the importance of clinical trials come into place, because then we get to learn about, yes, does this therapy work? But does this therapy also work better in, let's say, Native Hawaiians or Asian Americans or whatever, non-Hispanic whites? These are questions that we still don't know yet. And for CAR T therapy, we definitely don't know this answer just yet. And so that's the importance of clinical trials and getting the clinical trials to places like in Hawaii, where you just need to have more exposure to different populations and diverse races and ethnicities.
Hmm. There are also, I think, types of clinical trials, correct? Like, for example, in terms of its categories, invasive and non-invasive. And I think people, whenever they think about clinical trials, they automatically fear something that's going to happen to them in terms of like a procedure that they have to be performed. But many of them are also just simple surveys and questionnaires, just asking them to fill out a form. And that is also part of a non-invasive clinical trial. Is that correct?
That is absolutely correct. Yeah. Interventional and non-interventional are the two types of clinical trials that we have. So, I mean, there's just a huge range of clinical trials. It doesn't mean that we're doing anything to you in particular, honestly. It's just, um, it really depends. And the job of a physician and the clinical research team is to thoroughly tell you kind of what exactly does this clinical trial entail. And you as a patient or you as the research participant has all the right in the world to ask the right questions as well. And that's our duty to provide you with the right information.
Yeah, and it's up to the patient or the potential participant to always withdraw if they want to.
Absolutely.
And like,
Yes,
and they have that right. So I think it's important that
absolutely.
people also have that awareness. So there is also minority, not misrepresentation, but lack of representation in clinical trials. So how is that gap being bridged at the Cancer Center?
Well, it is a really important question that we have, and I want to show your viewers too about kind of what that means, right? Like kind of when it comes to the clinical trials. So, um, uh, it is a passion of mine to actually be able to increase the racial and ethnic minorities in clinical trial enrollment, because right now, there is still lots of disparities in clinical trials. So, for example, prostate cancer is 70% higher in African Americans than in the non-Hispanic white men. And they're also twice as likely more to die from prostate cancer. But in the most recent clinical trials that led to the FDA approval of the two newest treatments, only 10% of the participants in the clinical trials were African American patients. And so you can see kind of like a disparity between the incidence of cancer, as you mentioned, and also the proportion of the at-risk population enrolling in clinical trial. Now, our cancer center is very unique. You mentioned that we are the only NCI designated center within Hawaii and the Pacific Islands. So we have the power and the capability of educating not just Hawaii, but the Pacific Islands and even beyond about the value of clinical trials. And we are also able to open a lot of clinical trials, therefore providing access to all of these underserved populations to then increase in enrollment in these clinical trials to then hopefully address the question of these racial and ethnic minorities and hopefully better understand and push kind of the boundaries, right, of scientific discovery in the future.
Mhm. Dr. Si Lim, I would have loved to continue this conversation, but unfortunately, our time is out. But thank you so much. I really, really appreciate you spending time with me and answering some of these questions. And hopefully, it adds to the viewers' knowledge. So thank you and all the best with whatever you do. Thank you.
Thank you.
That is all for now, viewers. Stay tuned for more on my official YouTube channel and Facebook page. Until then, take care. Bye bye.